All right, this is being recorded. I wanted to just lay down the law a little bit here or let you know how this is going as we get started. This is being recorded. So if you're here and you're driving or you're vacuuming or probably out on a nice sunny walk, wherever you're at, this is being recorded. So we will send you the recording in the next 2 to 3 days, probably. We've got a big course coming up in the next 2 days. So this one might take a little bit longer for us to get out back to you, but don't worry about it. You can listen to it as much as you want. We post it on our YouTube channel, but it also will be sent to you in an email for registering. The next thing is that we turn off the sound for you guys, but please write all of your questions as you think of them kind of live in real time into the chat feature. We will have a section at the end to do Q&A. We hope to be done with this in an hour. My goal is to watch the NBA Finals Game 1 tonight. So we will be done around an hour. Franck is going to be presenting about 30 minutes, but we've got a Q&A at the end section in the end. So please write down or think of your questions. You can put them in the chat at any time, or you can wait until the Q&A part of this. So again, welcome to MedMasters webinar this Thursday, June 6th. We're super, as always, really honored to have you here. Our mission is to master the art of healing from the inside out. We really focus on offering virtual courses, plus the practical aspect of the learning process, and then resources, and then the business also. We've been working mostly in the space of ozone and UV the last 5 years. Ozone, UBI, IV space. So this topic of methylene blue is very close to us. It's definitely a trending thing in the IV space, definitely making a comeback from its earlier years in medicine. But we put these together at least once a month, sometimes once a week, to bring to you relevant topics and presenters in the integrative, regenerative, and functional space. So thank you so much to our guest, Franck Kacou. You don't know how to say it. I'm not French.
Keiko, you did right.
I didn't even take French in high school or anything. So man, the accents I can't even get right. But he's a pharmacist with New BioAge. Many of you are probably familiar with New BioAge if you've been following us. If not, you need to be. They're a fantastic network of pharmacies that not only provide really good quality products. I've definitely gotten more introduced with them or intimate with them in terms of peptides, because that was at least one of their pharmacies' kind of main focus for a long time, or has been. And now they are offering and teaching on Methylene Blue as one of their products. So definitely want to check them out. The last reason I really love these guys, well, there's lots of reasons, but lots of more that I could talk about. But the last one is because they are big on education. So if you become a member, if you become a client, if you use their products, they also offer tons and tons of education to you that's available through an online system that's really easy to work with, etc. So big fan of New BioAge. I've worked a lot with Leonard Strana, and this is his partner, Franck. And so we're going to turn the time over to him to speak about Methylene Blue, introduce himself. And again, you guys write your questions in the chat, anything that comes up, if something happens with their sound, etc. That's the way we know it, is if you communicate with us there. So again, welcome to our MedMasters webinar on Methylene Blue.
Well, thank you very much. I'm going to share my screen here. All right. Okay. I'm actually pretty excited about the game tonight as well.
I know.
Yeah.
I've been following it
be,
yes. We've got obviously some Mavs fans, Aaron's
yeah.
Dallas, so I bet that place is just crazy right now.
It's gonna be crazy. But yeah, my name is Franck Kacou, and thank you for having me. I'm a clinical pharmacist with New BioAge, and I'm excited to talk about Methylene Blue, which is actually a really old drug. It's been around for a long time. and there's a lot of application that we're going to be going over today. So let's get started. So Methylene Blue was the first synthesized drug actually used in medicine. You know, it was first used as a dye, as a stain, in 1876. And in 1886, what happened was a doctor named Dr. Paul Ehrlich noticed a pretty interesting phenomenon during his experiment when methylene blue turned live neurons actually blue. And he had the same effect on Plasmodium, which is a parasite that causes malaria in human blood. For the first time ever, they were able actually to cure an infectious disease with synthetic substance. So it's also known as methylenium chloride. It is now an FDA-approved medication that's been used as an effective agent in malaria treatment, septic shock, and other cyanide poisoning, among other disease states. It's a lead compound in synthesis of well-known therapeutic derivatives currently in the market. The next piece, let's talk about the chemical structure real quick. I'm a pharmacist, so I got to talk about it. So sorry, just hang tight with me on that one. So you know, it's a pretty awesome structure. So it consists of a thiazide ring, a thiazide ring, and a phenothiazide ring. So there's two rings, and they're connected by a central carbon atom. So it actually allows the structure to accept and donate electrons, making it a very efficient electron carrier. That same thiazide ring, which contains a nitrogen atom, is actually responsible, when you see the big N there, it's actually responsible for this pretty vibrant blue color of methylene blue. So it's highly visible under a microscope, for example, right? So on the other hand, this phenothiazide ring, on the other hand, can actually help with electron transfer of methylene blue, which actually help it participate in redox reaction within cells. So the central carbon that you see there play a crucial role in the electron transfer properties. You can almost act as a bridge, if you can think about it as a bridge between the two rings, which is actually facilitating the movement of electrons during cellular respiration. So again, it's well known as what we call an electron carrier capability. It can act as a artificial electron carrier within the the electron transport chain. It can accept electrons from reduced components of the chain and donate them to oxidized components. It's also a pretty powerful antioxidant. It's got antioxidant properties that can be mitigated, that can mitigate oxidative stress within cells. So it can reduce the formation of reactive oxygen species. I'm pretty sure you probably heard of what they are. They're often produced in the mitochondria during electron transport. So before we go forward, let's just go back to what exactly is mitochondria. So a lot of people sometimes just, mitochondria is pretty, everybody knows what it is. It's extremely important, but what exactly does it do? It's often referred to as the powerhouse of the cell, right? We all agree on that. So it plays a crucial role in cellular energy production through a process of what we call oxidative phosphorylation. So, mitochondria, it's cool because it's got its own DNA, right? So, like I said, it's a primary energy currency of the cell. So within the membrane of the mitochondria, you have this electron transport chain that provides a series of redox reaction that drives production of ATP, which is really at the end of the day the holy grail, right? This is how you boost cells. So it's cool because this electron transfer chain generates a bunch of protons across the membrane, which is taken by ATP. Okay, so we agree on all that. So it is an awesome thing to be when you're mitochondria. Why does it matter? Okay, and for people that can see this, I'll explain to it. But for people who can't see it or just listening to us, I'm just gonna try my best to explain what it is. So on the surface of the mitochondria, you have a series of what we call complexes. They're basically proteins that are involved in that electron transport chain that creates energy in the cell. So you have complex 1 through complex 4. And you also have something called ubiquinone or coenzyme Q, which is a lipid-soluble molecule that transport electrons between complexes among that chain. You also have something called cytochrome C. That's a small protein that transfer electrons from complex 3 to complex 4, if you're able to see this. So there's a bunch of things. There's a bunch of complexes. Obviously, it's complex, right? Why is this important? Because Methylene Blue makes it very easy. It makes it very efficient because it does bypass essentially all those complexes to create ATP. So you're able to actually have a compound that can act on the membrane and bypass a very important process, but still by creating energy at the end. And that's the key. You have to remember one thing about that. That's the key. So, we talk about, Methylene can accept the electron from ADH that you see there, which is in complex 1, right? So this ability to, go back to that, this ability to actually accept that electron is the first step. From there, excuse me, from there, you can also donate these electrons to the Q that you see there, or directly just bypass everything and send it to cytochrome C. So I'm not going to go too much in details about it, but basically what you want to remember is that Methylene Blue bypass complex 1 and 3, basically providing the ingredient all the way to produce ATP. So with that in mind, let's talk about some of the application of Methylene Blue. So there's a lot of applications. I'm just going to talk about one that we all know, which is COVID-19. And I know COVID is a thing of the past, but it's important to kind of talk about it because of its application for other disease states similar to COVID, right? So any type of viral infection or a bacterial infection can be something we can use Methylene Blue for. So in the case of COVID-19, I wish I knew the studies back then when we were all dealing with COVID-19, but most of the studies back then were using about 60 milligrams. Actually, well, actually twice a day. It was a twice a day dose of 2 milligram to 3 milligrams per kilogram per patient for 7 days. And the main benefits was around reducing inflammation and improving immune modulation. So which is amazing, right? So if you improve inflammation, you decrease inflammation, and you're improving immune modulation. And it was done like literally within hours of taking the drug back then. So in this table here, you can kind of see what the mechanism of action of Methylene Blue was or is for COVID-19. And main thing that he does is to reduce the viral entry of the virus into the cell, and it's done by reducing the binding of the spike protein to ACE2 receptor as the key feature of this. It's also reducing viral replication, but mainly is done by increasing the pH basically balance. But something that's also really, really cool that you need to think about too is that in that same mechanism of action, when utilizing light therapy, you actually decrease viral loads as well. So there's a mechanism of action here with light therapy to actually decrease viral load. And in the studies, if you care to read about them, they're showing the PCR results of people taking Methylene Blue and being on light therapy, red light therapy or photooxidative light therapy. So I thought it was really, really interesting. And we'll talk about it more in details down. But other mechanisms of action is, towards, reduce, cytopathic effect, reduce hypoxia, reduce hyperinflammation as well. Now, I wanted to kind of take a second here to talk about photobiomodulation, which is PBM, or we call it low-level laser therapy. I heard you guys, I know it's big in your world. Light therapy is becoming extremely important, and there's a lot of growing evidence to actually confirm this. And in a lot of the studies linked to evidence-based studies linked to methylene blue, the synergy between light therapy and methylene blue was extremely remarkable, and we'll talk about it in a second. But if you if you want to look at photobiomodulation, what do we know right now, right? So I want to point out a few things because it does a lot of things, but I want to point out a few things that are, I think, pretty awesome. So we know that people going through photobiomodulation should to alleviate pain, it should to accelerate wound healing. We know that for people with COVID, for example, right, you regulate cytokine storm, which is a big problem, right? And it was done by targeting mitochondrial respiration, and that was done without complete immunosuppression effect, like that you get on steroids, for example, right? So that's huge. Photobiomodulation is also able to suppress oxidative damage and inflammation in patients with Alzheimer's disease. So those are just simple things that light therapy can do. And forget about methylene blue here, just pure light therapy. And we know all the benefits of it. I just wanted to point at that because it's going to be good here, because here, awesome study that was published in 2021. All right, trying to get some evidence-based stuff to you guys. It was actually a double-blind study sponsored by the German government. I wish we knew about that, right? Sponsored by the German government. And what they did is they used methylene blue orally, okay, and they matched that or added photo PBM, which is light therapy, to it. And in the case of it, with the 1,200 patients, 600 received the mix of methylene blue and light therapy, and the findings were amazing, right? We're dealing with 83% reduction in hospitalization, 90% reduction in ICU admission, and 90% decrease in death within the group that received the methylene blue and light therapy. All right, so the study was there all along. We just didn't know about it. It was in Germany. Talking about COVID again, I know it's this thing of the past, but I just read yesterday, I was just going through my phone, they have some numbers out there about long COVID, right? So COVID is a thing of the past, but we have long COVID now, right? So 100 millions globally claim to have long COVID. In the US, we have about 22 million people with long COVID in the US. They are talking about 200 different symptoms reported with long COVID, but most of them are, neurological symptoms, so brain fogs, fatigue, being tired, anxiety in kids and such. So it's becoming a problem. So with billions of dollars being poured into long COVID research right now, I think, methylene blue can be a potential tool to be utilized right now in your practice. So a little personal story on this about long COVID. So I was a pharmacist working like crazy during COVID. And I noticed that, I don't know if you guys remember this, but Adderall was a back order back then. And people start talking, especially biohackers, start talking about using methylene blue instead of Adderall. And I noticed a lot of patients actually switching, because they couldn't get Adderall, switching from Adderall to methylene blue, right? And what we realized is all those patients on methylene blue back then were not getting the same. The people who actually were getting COVID, some of the patients were actually getting COVID that were on methylene blue, were not getting the same long COVID symptoms that everybody were getting. They're reporting less brain fogs. They're able to go back to work faster, among other things. So that's kind of where my interest in methylene blue started. From alternative to Adderall to utilizing in long COVID, and then since then it's been a journey. But anyway, so let's talk about some other quick application of it. Alzheimer's is a big one, right? So Alzheimer, just to kind of talk about what it is believed to be a vicious cycle, right, between beta peptide and tau accumulation. You have this nerve cell damage and inflammation in your brain, and such. So methylene blue comes in this and basically prevents this a peptide and tau aggregations mapping. It's a very simple mechanism of action to actually help with that. There's a bunch of studies out there talking about utilizing oral methylene blue in patients with Alzheimer's disease. And why it's so important too, because of its lipophilic effect, which is actually help cross the blood-brain barrier pretty quickly to go to the brain pretty quickly, is key to this. So there's a lot of studies out there, and actually on this page here, you can kind of see the aggregation, right, of the AB and the tau right there, and you can see how methylene blue can come in and actually prevent this aggregation from happening, which is very, very, very cool. And more importantly, what methylene blue does is it actually increase mitochondria function in the brain. So which is a big problem, right? Because you have, if you remember to what we talked about earlier, if you're able to actually bypass this complex 1, 2, and 3, okay, and go from 1 to 4 and creating ATP, which is basically the holy grail for mitochondria, right? And regenerate mitochondria, then you actually eventually able to actually make the patient better, right? Because you're actually going to the source, you're making mitochondria better. And that's usually important for people suffering from Alzheimer. Here's a 1996 study back then already, showing 81% reduction in the rate of cognitive decline after 50 weeks on people utilizing 60 milligrams of methylene blue 3 times a day. So the evidence is there. You can just go out there and look for it. Parkinson's disease, same thing, right? Patient with Parkinson's disease tend to have a lot of positive outcome when initiating methylene blue. And it's mainly done through, this neuroprotection of methylene blue, provided by methylene blue, upregulation of BDNF, improving mitochondrial function, reducing oxidative stress. Where it's pretty cool is with mood disorders. So a lot of patients coming to you with mood disorders, right? They usually are depressed, anxious, they're just not feeling it. They have problems. They just, we all have issues. So mood disorders are becoming the #1 problem that we're dealing with as healthcare providers. And we don't really have a lot of tools, right? We have old tools out there, antidepressants, benzos, and such. But here you have an interesting option here. All right, so what we know so far, we know methylene blue increase mitochondrial respiration, it improves cellular energy production, right? This can actually be particularly beneficial for people with mood disorders, because most of the time when you have mood disorders, you have mitochondrial dysfunction. That's just automatic. So methylene blue inhibits MOA, A and B, which is the enzyme responsible for breaking down neurotransmitters such as serotonin, dopamine, norepinephrine, to name a few. So by reducing this enzyme, methylene blue can actually increase the level of the same neurotransmitters. So that's actually pretty fascinating. It can be done naturally without adding, Lexapro and Paxil. Okay. So that's something to think about. We also have this antioxidant properties which actually can protect neural cells from oxidative stress, which is a factor implicated with the pathology of mood disorder. So there's a link there. Plenty of evidence-based studies out there. Again, so we're just trying to give you a lot of evidence. It's just not saying things. There's a lot of studies out there that actually go in details about it. Yeah, so topically, I also want to bring some topical application again, because I love the light therapy. I think the synergy between the two is just unbelievable. So topically, methylene blue be utilized for anti-aging purposes. People are using that currently for trying to look better, make the skin make their skin a little bit smoother, and such. However, there's a lot of evidence out there showing also pretty good evidence as far as utilizing that for people with acne, right? So we don't really have a lot of options. We haven't been, for acne. So it's either a very expensive commercially available drug or using over-the-counter drugs. But when you use Methylene Blue, okay, with salicylic acid in a compounded version, and you add red light therapy to it, you can actually decrease acne lesions, and um, that's been studied, and there's actually evidence out there of how to utilize that. So here's an opportunity for you guys to actually start looking into potentially bringing Methylene Blue into the practice for anti-aging topically, but also for people suffering from acne as well. I think it's pretty cool. Again, once you pair that with red light therapy. Um, Antifungal, right? Onychomycosis is another one. So people suffering from, you know, from fungus in the nail, right? So there's a lot of studies on that as well. So this is a very inexpensive approach to this, where you can literally decrease or completely cure, um, uh, onychomycosis within 12 weeks. And it's been proven already, again, by utilizing Methylene Blue and red light therapy. more applications of Methylene Blue here. So another one that I really like here is for pain. So there's more evidence, growing evidence of utilizing Methylene Blue for as an analgesic effect, right? So in this particular study, they used that after post-op, low back pain surgery, and all it did is to give about a 0.5% concentration of 1 ml that they use to coat tissue surrounding the area after surgery, and with a lot of results. A lot of patients are actually um, using less opioids upon waking up from surgery, and that's documented in the study. The more recent studies about analgesia are geared towards oral pain. So patient there's a pretty big program out of Texas that recently published some studies on utilizing oral Methylene Blue as a mouthwash almost for people undergoing chemotherapy for throat cancer, mouth cancer, and neck cancer. And what was cool about it is they're using only like a 5 ml swish and spit type of deal. And they're using that every 3 hours. So after the first dose, the patients are already reporting less pain. Why it matters? Because compared to other compounds, their mouth was not numb, because that's the key, because you don't want to have a numb mouth or a numb throat, right? So people were not numb, and more importantly, the taste bud was not altered. So there's a lot of evidence there with pain. Well, we got to talk about the bad, right? So adverse events, adverse side effects of Methylene Blue. Well, the good news is there's not a lot of side effects. It's been around for 100 plus years. People with a lot of documentation as far as side effects profile. So we know what the expectations are as far as side effects. It's pretty safe to initiate that, especially at low dose. The side effect is dose related, it's dose dependent. So the higher you go on the dosage, the more you might get some side effect. The only side effect there's two side effects that you have to be aware of. So if you have patients out there on any type of antidepressant, right? So you have SSRI, you have MRI, Wellbutrin, Lexapro, and such. As you go high in dosage, there's a potential chance for increase in serotonin syndrome. So serotonin syndrome is actually a pretty dangerous side effect. So you have to be aware of that. Now, in practice, we do a lot of Methylene Blue. We have a lot of patients on Lexapro and other SSRIs. We have not seen any side effects. People use Methylene Blue in hospital settings every day on people who are taking SSRIs with not a lot of side effects, but you have to be aware of potential side effects there. There's also people with G6PD deficiency, which is an enzyme. Methylene requires G6PD to work, so it's actually ineffective in a patient with G6PD deficiencies. But when you have a G6PD deficiency, you actually might cause patient to also have other problems, especially on hemolysis and anemia and such. So there's 2% of the population in the United States actually have a G6PD deficiency, so you have to be aware of it. Most clinicians will start pretty low on dosage, or potentially test for it first, and then as they'll go high on dosages. So something to be aware of. But those are really the two biggest things that's, that you have to be cautious about. Dosage form available for Methylene Blue. So let's talk about that real quick. Again, we'll talk about, anti-aging cream being a big deal, right? It makes a lot of sense, especially now that when you combine that with red light therapy, right? It's actually even a game changer. You have troche form, you have solutions, and you have IV, right? So injectable Methylene Blue is also available. And we actually have a bunch of anti-aging stacks. I call it anti-aging stacks that we use IV protocols of Methylene Blue with NAD and glutathione. And we can talk about it later in the Q&A if you have any questions. Kinetics of Methylene Blue is actually absorbed pretty quickly. So 1-to-1 bioavailability, IV to PO, and it peaks pretty quickly after 30 minutes after you take the drug. Is distributed evenly among different tissues in the body because of this this balance lipophilic and hydrophilic we talked about in the structure part of it. Excretion, patients will should be aware that they might pee blue, right? This is a side effect of it. So something to think about. It's not a vibrant blue, but it'll be a little blue. Half-life's about 5 to 6 hours. So the compounding formulations that are available out there, as you order those things, hopefully you'll be ordering those things through a reputable pharmacy. You can ask your local pharmacy to compound this, but Methylene Blue capsule, usually your first option is IR, so immediate acting drug, 5 milligrams to 100 milligrams. Usually want to start low, and then go high as patient tolerates it. There's also a sustained release formulation that's also available for some patients. I really think it's a great idea. Then you have the 1% oral suspension that we talked about for oral pain that can be utilized. For cosmetic, you have Methylene Blue in the biopeptide topical solution that we recommend for compounding. Usually a compounded product will have usually the right amount of peptide in it, so you can add things like GHK-Cu, copper. You can add, which is a peptide. You can add other peptide to it to actually work in synergy, right? For that topical solution. You can also play around with different things, right? You can, there's a lot of talk about Oxytocin, right? Oxytocin is an awesome product, right? So any type of neuro function, if you have a patient on antidepressant or trying to get off antidepressant, or if you have people talking about anxiety, adding Methylene Blue to Oxytocin is a very, very good option. It can be done through a nasal spray, which I really love. It can be done sublingually, and we can talk about dosage if you have any questions on that. You can also add Methylene Blue to low dose naltrexone. I think it's a very, very awesome combination, right? They work in synergy again, right? So if you have, if you don't have a lot of options, and and the patient doesn't want to spend too much money, and you want to cover your bases, it comes down to anti-aging. A low dose naltrexone and Methylene Blue is a good way to go. It can also be used for wound care, so we do a 10% topical hydrogel solution for wound care as well, because of the antimicrobial aspect of it. So here's my favorite slide. This is the most important slide for me, literally. And I'm going to take some time to talk about it a little bit. So when you source Methylene Blue, you have to be extremely careful. Okay, so, and that's the pharmacist hat now. You have to question where you're getting it from. You have to question where your suppliers are getting it from. You certainly don't want to send your patient online to get it. And the reason why is because there's different chemical grades of Methylene Blue. Hence why it's not really available in the compounding world. And it's easily available online through Amazon, things like that. But there's a difference between USP grade, FCC grade, and lab grade. So most of you probably hopefully know what the differences are, but for the people who don't, USP grade basically means that it meets all or exceeds, I guess, all the requirements of the United States pharmacopoeia. This is usually what compounders are using. It's usually what drug manufacturers are using to make the injectable. It has to be a USB grade. When you can find USB grade, it's okay to use FCC grade. FCC grade is a food grade product, so you have to be aware of that. But we'll talk about why it can be problematic. FCC grade standard are recognized around the world as being a food grade product, so you can utilize in food and things like that as an ingredient. And then you have lab grade, which is a no-no. So lab grade are a problem because you don't know what the exact amount of impurities in the product. So you have to be very, very, very careful when you get that. A lot of times, if you're spending, if you look at the price of Methylene Blue from a reputable pharmacy, one of your local reputable pharmacy, and you're looking at the price of Methylene Blue online, and you see a big difference in price, there's a reason why. USP grade, which have to be sensitized and remove impurities from the product, is more expensive to get, right? Compared to a lab grade, compared to FCC grade. So think about those things. And why it matters because Methylene Blue has one problem. And the problem is that it does contain a lot of metals. So some countries, like in Europe and France for a long time, banned Methylene Blue because of the high amount of arsenic, the high amount of mercury, lead, and other heavy metals in it. So if you can't control your supply chain, it becomes problematic. And it's why you have to ask the right question when you're dealing, with Methylene Blue. You have to make sure you're getting from a reputable pharmacy. It's extremely important. There's something called a certificate of analysis that most compounders are using, and we have to make sure that impurities is less than 0.5%, less than 0.5% in a total assay, meaning that you have the old powder that you order from your manufacturer, it comes to the pharmacy, you're looking at your paperwork, you have to make sure there's less than 0.5% of arsenic, mercury, and lead inside the product. Most reputable pharmacy, that's what you're looking for. Now, within the reputable pharmacies, there are other pharmacies that actually have higher standards. So for example, with us, when within a network of pharmacies, we like to utilize, suppliers that can provide less than 0.05%, which means that there's even less chance of impurities in the product. Okay. Industrial grade products, for example, can legally contain 8 to 11% impurities. So you have to be very, very careful with this because you don't want to trade, fixing mitochondria, and flip it and create more heavy metal toxicity. So that's extremely, extremely important to think about that. So that's why I like to, finish with this because it's really at the end of the day, great products, great compound, but you have to make sure you're getting the right stuff. And that's how you can tell, right? Make sure it's USP grade, ask the questions about impurities. And this is how, as a prescriber, as a clinical or as a clinician, you can start understanding and find better quality pharmacies and better quality products online and direct your patient to where they need to go. Well, I think that completes my presentation here. But I think Methylene Blue should definitely be a top compound in any toolbox out there for any clinicians. Just simply due to his ability. I've never seen anything like that. His ability to improve mitochondrial function. There's a lot of products out there that claim to be doing that, but the ease of operation of Methylene Blue is unbelievable. It's got a solid track of record for safety and potential applications out there. So thank you for attending, and I think we can take some questions now.
Yeah, thanks, Franck. This is awesome, and we do have several questions coming in. I wrote down several before we even sat down because again, just being in the IV space, and then also I take this, and so it's some of my own experience in both ways. But let's look at the questions first. And they're a little bit all over the place. Maybe you've seen them, but real quick, do you guys ship to New Hampshire?
Um, I think I believe so. You got me there, but yeah, I believe we do. Yes, yes,
Yeah,
we do.
those are ever-changing things, and I'm sure that you guys have a list, etc., if they reach out.
Yeah,
Um,
yeah, yeah.
Along those lines, we do have a landing page that has all of our affiliate partners on it. I mentioned that earlier, and New BioAge is one of them. So if you go to that landing page, it'll take you directly to New BioAge's wholesale and provider information. That link is lookforthecause.com. I'm sure Franck can give us other things too, but it will take you directly there, and they do have options for education and finding out what states they're in. We
Mhm.
also we have a peptide course coming tomorrow. If you haven't heard of it, we're doing 2 days on peptides, and Leonard, Frank's partner, is speaking there. And so we will provide in that training a list of all the are they called compounds, I guess, as you would do it, products that your pharmacy network is able to supply at this point. So there's some access to the things and the states and the places that New BioAge is doing. All right. Do you have any understanding of hyperbaric oxygen treatments? Would you have a comment on how that might be utilized with methylene blue?
I have a pretty basic understanding of it. I'm just trying to think about how the synergy can can work there. Um, there's hmm, I certainly don't want to give an answer that I'm not sure about. So no, I'm gonna have to pass on this one. I can definitely see a potential there. I'm trying to think about the mechanism of action and how it can work.
Yeah.
But I think there's definitely some synergy there, um, with the oxygen carrying capability of Methylene Blue as well.
Yeah,
Yeah,
I think that there's some things that would make sense in that
yeah.
combination. I don't have any
Uh,
experience with it either. Definitely on the UV side. So excited you brought that up. You guys, I did not ask him to. I didn't pay him to, nothing. You guys know I'm
she
a
did
fan.
not. She I promise she did not. It's just out there. It's crazy.
It's the coolest thing, and that's
Yeah.
I didn't know about the German study, so I've got questions about that. But the
Mhm.
synergy there, and in terms of, it sounds like even different light frequencies, red light, low light. I don't know if ultraviolet is also one of those. You'd think so in terms of the COVID, but in terms of the German study, do you know how they applied it? Because I think you said oral dosing, 60 milligrams or so, but then electrified, I'd say,
Mhm.
by the light therapy. Do you happen to remember how they did the light therapy?
So I got the study. Let me see if I can pull it up here. Because you guys are professional of light therapy. I am not.
Yeah. So I have some links on this, but
uh,
I've been lecturing on this a lot lately. I did put
yeah.
together, you shared a lot of the same studies. I just didn't know about that German one. But man, it's the coolest thing to see the synergy between the two. So if you guys have
Yeah.
been some of our clients for a long time, and we've got the ozone and the UV, IV therapies, right? There's a few different ways to do that.
Mhm.
But if you're dripping methylene blue, you can actually run it through a UV light. So that's one way. But I didn't know about the cosmetic portion of it also, or the acne component of the red light therapy directly on the skin. So I was curious on the COVID aspect, how they do that. Um,
So, yep. For the COVID part, they had two options there. So they have two different groups. There's a group that actually taking the tablets, the capsule by mouth, and there's a group that actually was using um, a topical nasal, um, co topical nasal 1% methylene blue that they're applying inside the nostril.
hmm,
And what they're doing is they add a machine that they're actually utilizing at home right after taking the medication. So they're using red light therapy and they're putting that into their mouth I actually have I almost want to,
Because
let me
does
do
the
this real quick.
methylene blue itself have to be exposed to the light, or is it the combo, the
The,
true synergy in
I
blood?
think so. When you take Methylene Blue, the distribution to the tissue is like instant. He works so fast, so it gets distributed towards the tissue pretty quickly. And we're thinking that um, there is a synergistic role when they're both working with different MOA, mechanism of action, but there's also a component of the light therapy making the drug absorb better on the tissue. If you see what I'm saying.
Yes.
So it was
Yes.
like it's almost like two things at the same time,
Yes.
right? So I want to share. I almost want to share this because I want to show this
Well,
to you
and then
guys
they
real quick.
both have their individual antiviral components, right? I mean, they both are
Correct.
individually known to help and treat viral infections. And so then there
Right.
could be just the synergy of maybe two different mechanisms, maybe two different sources, et cetera, but working on the same problem.
On the same
Anyway,
problem. Right. Right.
that was definitely
So
fast.
I got some stuff here that I want to show you real quick. If that's okay.
Yeah.
Okay. So let me show you this. Um, and you tell me if you can see it. Okay.
Yes. We see all your slides, but yes, I'm aware of this mechanism for the mouth.
For the mouth, right? So this is what they used here: 660 nanometers of LED lights to stimulate this methylene blue solution via nasal and oral cavities. So they used
Okay.
that um, for 5 minutes, basically, afterwards.
Okay. Really good to know.
Um, no, it's amazing. And this is the result they were getting from first PCR results, which is viral load in the patients after they're using this. It was just unbelievable um, the way they did it. And every patient
Fascinating
actually
to treat it
utilized.
so, sorry.
Go ahead.
It's fascinating to treat it so localized that you could have such a systemic effect, right? The lights in the mouth, the
Correct.
oral dose, but you said what it showed is such a decrease in hospitalization, et cetera, not just like, throat discomfort or something, or, like it's really fascinating, the systemic, capacity of it.
The capacity of it. Absolutely. Absolutely. So yeah, I just wanted to point that to you guys. It's just interesting. And I think it's this combination of, this distribution across the tissue and the absorption, because that's one of the things that light therapy does. It helps with the absorption of whatever it is into a cell. So when you have good stuff in the cell and then you're utilizing that, the absorption is even better. So
The study I came across said it actually increases the electron capacity of the
correct.
methylene blue. Like the
Hmm.
exposure of the light on methylene blue actually increases that electron, uh, like you said, the electron transport
Right.
chain, and then how the electrons are being utilized in the system. But it
In the
was the
system,
combo
right?
there. Yeah. Um, I mean, I knew this was
Absolutely.
trending, but to see the science and see what it actually does, you've been a proponent of all night long, is just makes it so much more secure for providers to use it and really justifies the use of it. All right. Hi, Courtney. Nice to see you. Courtney asked a question, how or what doses are you finding safe of methylene blue to use with those SSRIs? And I was going to ask the question, what is a high dose anyway?
High dose will be anything above 60 milligrams daily.
Orally
So
or at
orally,
all?
yeah. Most patients that I have out there, I think it's safe to be between 30 to 60 milligrams a day. Depending what you're treating, what you're working on. If it's something that you're using for long COVID, something you're using for just for brain function, meaning that people that are trying to be a little more clear. Because one of the things that once you start taking Methylene, you quickly realize that you think clearly, you have more energy. It's unbelievable, right? So, um, if you start flirting with a higher dose, like 50 to 60 milligrams, I think you're still safe. Anything above 60 milligrams, and you're on, I said 10 milligram Lexapro, you just got to be careful, right? And then the thing about serotonin syndrome is, it's a side effect that's not going to happen like just right away. So, patient needs to be taught that, we need to explain what the side effects looks like to the patient, right? To be able to know. Because you definitely don't want to tell a patient, okay, stop your Lexapro, initiate this, right? It might have to be something where, hey, let's titrate you down a little bit, let's introduce a new compound here, see how you feel, type of deal. But I think 60 milligrams is a sweet spot. Nothing more than that. You don't even want to start that high.
Yeah, so you talked about different protocols in the literature.
Yeah.
I was just trying to think, I take 25 milligrams every day. It's
Hmm.
one capsule with 25 milligrams.
Right.
Uh, and then my practitioner said, when based on tolerance will increase you to 50 milligrams. And I've been doing this for like a month or so. But
Hmm.
what does that look like in terms of tolerance?
So, with anything that you take, you're going to excite the receptors, right? And it's all about finding the balance between, making sure your receptor is still nice and open, and increasing the dose. So you know, tolerate 25 milligrams will be, you're able to sleep at night, right? Number one side effect of this thing is tachycardia potentially, or you just go, 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 go and never stop,
Mm.
right? So you're gonna start seeing things like, okay, so am I able to sleep at night a little better? Is one way to see it. Because most patients on Methylene Blue are, you know, you know, stimulated pretty well, right? So it's when you go too high, then you're unable to sleep. Insomnia becomes problematic. And I've been telling a lot of people, when you start seeing this, you have to come down a little bit, right? It's really, I see it, tolerating it. That's usually an easy way to tell your patient, hey, it's a little too high. If insomnia becomes problematic.
Okay, do you notice that the urine output may change over time?
Yeah,
Um, I've
yeah.
asked now that you guys know that I'm taking this, and I said it was a personal thing, but I've heard this also is that over time, like a daily oral dose, their urine is less and less blue. And it's
Correct.
this just it's like it's met capacity, the tissues are saturated, or is it the body's assimilating it better and utilizing it better? Would that
Well,
be an indicator
it's
of
a lot of time
receptors?
is being excreted as leukometal. So basically, it's being excreted as leukometal blue. And don't forget, leukometal blue is colorless. It's clear.
Hmm.
So it's the balance between oxidation reduction. So when that's a very good point that you're raising there, is when you start taking it for a long period of time, you're gonna start oxidizing,
The
in the sense
oxidized
where,
version of methylene blue, even if you saw it in a vial, etc., is clear.
correct,
I get
clear,
it. I get it. Yeah. So what you're
exactly,
actually excreting is the oxidized version.
exactly.
Interesting. I didn't think about it in terms of urine output, only I knew again through all my research. And so you can actually, if you mix methylene blue with, let's say, vitamin C, it may actually neutralize it and it would look clear.
Yeah,
All right.
it's a
We
good
have
way
so
to
many
see it.
questions. I think Courtney, he answered the question on mercury, and obviously New BioAge is very particular about that. I just recently, not recently, but recently learned of a few pharmacies who have been mindful of that. So just because you trust your pharmacy or you've been using them for other things, I still second everything Franck said about just checking for that certification.
Mhm.
What's the highest dose of methylene blue that can be used IV?
Depends
At
how
what
they're doing
time,
it.
I'm guessing.
It depends how they're doing it. I wouldn't do more than 20 milligrams.
Interesting. Okay.
And what are you
Um,
adding? I mean, are they doing methylene blue by itself? You know, um, are you adding NAD? Are you adding, glutathione? What do you, so it depends on what you're doing.
Let's
what am
say it's
I,
by
what,
itself. Let's say it's by itself. How would you mix and deliver an IV methylene blue?
so, Methylene Blue, I believe, I mean, depends if you're getting commercially available, it's a 5 milligrams per ml concentration. Okay. It's typically what you're getting out there. I usually like to do, 20 milligrams total, okay, of the Methylene Blue, that you are putting in, in your NS bag. 250 will just be just fine. Um, you can also add an AD. You can also add glutathione, but I will be more comfortable doing 20 milligrams in the patient first. Now, if you're talking about a brand new customer that coming into your clinic, they want to try this. It's pretty awesome. They want to have a good experience with it. 20 milligrams.
Okay. I got one last question on IV, just because this circulates a lot. We got New BioAge's Methylene Blue in early May in Indiana when we did our anti-aging IV and aesthetics course. And we mixed about 10 milligrams for most people, except those who'd been doing it orally previously. So we already knew, some of their tolerance. And that was actually those of us who were practitioners. Um, and there's debate about whether to mix it with NS or mix it with dextrose. And I thought you would be the perfect person because I believe it's a chemical dynamic. So a lot of reports when you do it with NS, it burns. But I can tell you everybody a month ago who had 10 milligrams and 5 D5W, it didn't burn. There's definitely a notice though in their arm of the drip going in. Do you have any comments on that?
Yeah. Don't forget about the structure that we talked about, right? So it's um Methylene Blue. So okay, so it is definitely going to burn a little bit when you use normal saline, and that's due to um the way the drug is being distributed in a sense, or metabolized actually. Sorry, metabolized. So usually it goes into a polar state. So anything that's polar will burn literally more than anything else. So if you use normal saline, yes, you have more chances um, of causing that because of the polarization of the concoction of both of them. So I can see that now with dextrose. Uh, I just I don't know. I really don't know, to be honest with you. If the question is which one will burn less, I'll definitely say dextrose. Is it better absorbed or distributed between the two? I don't know.
Yeah, I haven't heard that
I don't
either.
know.
We've got several providers using it with UBI, of course, and other ways who have talked about just they see less burning, less irritation, mixing it with the dextrose. But I can tell you, and everybody, I don't know, we did 10 IVs or something that day. Everybody still did notice something in their arm. It wasn't necessarily discomfort, which I also thought was interesting because the D5W is going to decrease pain.
Right.
Technically. So, anyway, just something to note there if you guys are IV practices. And maybe a way to even, I know there's plenty of franchises, IV franchises who have brought this in. And I think all the ones I've seen and know about there are mixing it with NS. So what is you said 20 milligrams in a 250 bag of NS over what period of time?
Um, hmm, Good question. I mean, firstly, uh, I'll do about 30, 60 minutes.
Yeah, that's what we've done
Yeah.
too. Okay, cool. Hi Melvin, Dr. Nario. Let's see. We'll talk about pricing, or we'll send out the pricing list again. We can give that to you. I don't even know if you would know it off the top of your head, Frank, but can it stain your teeth permanently?
Good question. Excellent question. With good oral hygiene, no.
Well,
So,
it's gonna
yeah.
it's going to help, right? All the bacteria, et cetera, in there. So it's a give and take.
Exactly. So I was extremely worried about that, and that's a very good, valid question for whoever asked that question. However, from what we're seeing is with good, proper oral hygiene, there's nothing to worry about.
Okay.
And don't forget about the fact that it does, become colorless at one point anyway. But
Does it
yeah,
matter what's in
it's
your mouth? Because the porcelain bowl in my bathroom, it does stain it permanently. If you had any porcelain in your mouth, I could see
yeah,
how, but the plastic,
yeah,
no. But I
no.
definitely have to use bleach all the time.
No, no, that's a very good point. And I'm actually, we have some vendors who are actually trying to figure out how we can, um, you know, make actually dispense the Methylene Blue instead, which is the colorless version of it.
Yeah.
We're working on those things, but yeah, it's something to worry about for sure. But I think with good oral hygiene, you'd be fine.
And no joke, if you're doing it for your patients and you want to give them a handout, by the way,
Yeah,
I included all that in the regenerative aesthetics course. It's available to purchase if you like it. But if you're doing this like patient handout, which you should on anything that you
yeah.
give, one of the discharge instructions is to say flush the toilet quickly because it does reduce. It's no joke. Like it's seriously like crazy.
Yeah.
All right. Dr. Naro also asked this question, which I thought was good. You kind of led into it with, well, can we add NAD or glutathione in the same bag as methylene blue?
Absolutely. Absolutely.
Okay.
I'll do, I mean, that's my recommendation. It's not a protocol, but I'll go with 20 milligrams. This is the pharmacy side, right? 20 milligrams, Methylene Blue. I'll go with, let's say if your NAD is about 200 milligrams per ml, I'll go with 10 ml of that. Okay. And your glutathione, same thing. So same value in glutathione, same on NAD.
So glutathione is usually 200 milligrams per ml, and you're saying
Correct.
10 mLs of that also?
Yeah.
So 2 grams. Okay.
So 2 grams.
Um,
I think it's actually a pretty awesome anti-aging stack right there. Yeah,
yeah, that's fascinating. And it all can go in the 250 ml bag.
correct. You can do
Okay.
500 if you want that.
Yeah.
Yeah,
And it
but
would be a
same
little
rate.
diluted, run it a little bit faster, probably.
Right. Yeah.
I want to throw this out there again. I am not a pharmacist or a practitioner, but I have heard a ton of lectures and visited with a ton of practitioners. And like David Minkoff lectured for us at SobCon last year, a little bit on methylene blue. We've got again in our network, and there are providers going up to 100 milligrams in an IV bag, but
Hmm.
again, like what's the carrier solution? How big is it over time? And definitely looking at that SSRI profile, the G6PD aspect of it. But just to say that, I do know that that does occur. Probably on a much lower scale if you have to compete with some sort of IV bar.
Hmm.
All right. Oh, Courtney asked that question on D5W. Oh, good question, Diane. How long is an oral course? Days, months? And how long would an intravenous course be? Weeks or months?
So very good question. I usually, when you initiate a patient on Methylene Blue, first of all, based on what they're trying to achieve there, is it an anti-aging supplement that you're trying to add to it, or is it more for neuroprotection? Is it for cognitive function? We got to figure out. But I usually recommend somebody titrating it up from the low dose, which is the 5 or 10 milligrams. Okay, maybe 10 milligrams potentially, to a more like in your case, like to a more stable dose of 50 milligrams, for a 3 month period, and then take a break, take a 2 week break, and then go back again. And the reason why you want to do that, I just want to reset your receptors there, to make sure, because you're not going to withdraw. You're not gonna have any issues if you stop for 2 weeks. You're still gonna have the good benefits of the medication anyway. However, I think taking a little break, if possible, will reset the receptors. Yeah, that's what we're saying with people going higher in those. Is probably, I think they most likely are going up too fast. and it's just not working as well, and then that's the problem. And it's those dependent on the side effects profile. So the higher you start loading with 100 plus milligrams, yeah, you're gonna have some great results, but you're putting yourself with potential risk of side effects um down the line. But a lot of the good sweet spot is 60 milligrams, which is if you can have patients right there, and they're literally like taking breaks, 2 weeks breaks, holiday break, going back to it, they'll be fine. As far as Methylene Blue in IV, I'll say you should be getting get your patient on it. There's nothing wrong with getting that. Like, every time they come in. So if they're coming in on a, 4 to 6 weeks interval, there's nothing wrong. Especially if you're on the low dose. If you're 20 milligrams per ml, you're doing anti-aging stack with patients. Yeah, every 4 to 6 weeks, they should be getting their Methylene Blue. There's nothing wrong with that. It's
Would
high
you
distribution anyway.
Yeah, would you stack? I like this idea of the 60 milligrams because you've got all this evidence to support it.
Right.
Um, I like that. I think everybody here likes that. Would you do something different for acute? Like I know a lot of practitioners doing oral, etc. Well, oral for like active or acute UTIs. Like we talk about COVID.
Mm-hmm.
Would you stack them and would you say it's probably okay to do more, like you said, for anti-aging 4 to 6 weeks, but what if it's like a current infection?
7 days, usually 5 to 7 days in high dose. So you'd be doing 3 times a day or, a high dose, but you're doing for 5 to 7 days usually.
Okay. And I was going to say too, my recommendation from my provider, which you all know, that's why I'm not saying it, but yeah, I'm on 25 milligrams, but the way she does it too for herself is she's noticed we do 5 days on during the week and 2 days off for the weekend.
I
Same
love it.
concept, right? And
Yeah,
orally, we take it in the morning due to that energy thing, and also on an empty stomach or not with food.
mhm.
Is that the
Yeah,
best way?
yeah, absolutely. There's nothing wrong with that. Absolutely. Yeah.
Okay.
And for your and then for your patients, that are not getting, red light therapy, I usually recommend 30 minutes out in the sun daily.
I can do that. I like that
Yeah,
too. Does it need to
for
be right
sure.
around that time or probably by then?
Yeah, yeah. Around that time would be great.
It is fascinating how quickly this goes through you or absorbs in the tissues. Like you take it in
Yes.
the morning and your first time to the bathroom and it is blue. So I
Mm-hmm.
would think then that the activation of light would probably need to be really quickly.
Yeah.
One question I had is, do people ever get a lull before a high? And everybody wants to talk about detoxing, but as you're producing more ATPs, you're producing that energy, kicks out things from cells because redox balancing is going to create some cellular debris, so on and so forth. Have you heard much about that, the lull before the benefit?
No, I have not.
Okay. Um, Somebody asked about the protocols with your products. You mentioned you could go back and talk about that, not the protocols, but maybe the dosing with some of those protocols. I am fascinated with the oxytocin, with the low dose naltrexone. That all makes gobs of sense to put them together.
Oh, absolutely. On the Methylene Blue, if if you're trying to achieve, um, in this with oxytocin here, it'll be more of a, you're looking at anxiety in a patient and you want to initiate Methylene with oxytocin. You're probably going to be at a lower dose of Methylene Blue, so anywhere between 5 and 10 milligrams, and about 25 units of oxytocin, um, um, sublingually will be a good spot there to get started, right? With those naltrexone, will be 5 milligram Methylene Blue with a 3 milligram of those naltrexone together will be where you want to be on those two. On the Methylene Blue biopeptide topical solution will be a really, really low dose. So it'll be like a 0.0002%, very similar to like a rapamycin, because rapamycin is also um, being utilized right now for cosmetic purposes. And it's huge. I mean, there's a lot of data on that as well, but it's a very minute concentration. So same thing here with Methylene Blue. But all those synergistic peptide there and compounds there, I really like Methylene Blue and low dose naltrexone. I really do. And that's something I could be taking forever,
Hmm.
especially at low dose.
Yeah, I
So let me
like it.
tell you, like, yeah, if you want to cover your base, right? Some people say, let's do metformin, low dose, let's do this, low dose. I say you want to modulate your immune system, right? And you want to amplify your mitochondria. And you can't, I don't know anything else out there. So you got low dose naltrexone doing the job for you. And then you have Methylene Blue doing the job. And that's your base. You have low dose right there and you stay there.
Yeah,
And it's
didn't know
cheap.
that combo. Yep, I could see the value in that for sure.
Right.
And I'm guessing all those compounds that you spoke about, you guys have.
Oh, absolutely. Yeah, absolutely. We do. And if you're willing to share our compound, list from a network of pharmacies, that'll be great. You
Yeah,
can see some of the products that we have there. And more importantly for us, I mean, if people have any questions, they can always reach out to our team. We have a bunch of clinical pharmacists here that can help. Yeah.
yeah. So I was going to talk about that. I have a few slides because you're going to need to see them because I've got some codes. You guys can scan the codes to go where you want to go. But I mentioned we are hosting our peptide course over the weekend, Friday
Yeah.
and Saturday. Leonard from New BioAge will be there, and they've got a promo of like 10% off certain things and also the free consultation with US providers to learn more about what they do or any questions that you might have. There's specifics to it. But that is a benefit of coming to the peptide course tomorrow. And if some of you I know are already signed up, thank you so much. And if you're not, that I'll get you a code here in a second. While I pull those up, Franck, Courtney's last question here. So for Parkinson's disease, would you recommend a higher dose, more frequent IVs, or would you recommend PO? I'm guessing that would kind of go into Alzheimer's, et cetera, too.
No, this is a great question. So I can tell Courtney that is it Courtney? I'm sorry, it's Courtney, right? Yep. I can tell Courtney that on all the evidence-based studies, which has been published in 2021, okay, they use oral Methylene Blue. All right, there's actually an awesome study as well that was just published through neuroscience, utilizing photobiomodulation and Methylene Blue for Parkinson's disease, and they're using oral as well. So, and don't forget, it's a one-to-one bioavailability. So even if you're more comfortable doing the IV, that's okay. There's nothing wrong with it. So you literally have a patient coming to the office and getting a stack, and you can discharge them on oral going home. There's nothing wrong with it because they won't be able to get access to it every day, right? So they can come in the office, get a nice high dose if you want to, because it's on the higher dose. By the way, for Parkinson's, you're looking at 60 milligrams 3 times a day.
Yeah, that is interesting. 60 milligrams, but 3 times a day. Melvin had a good question off the topic though, but more on low-dose naltrexone. Can you use that for healthy individuals?
Oh,
Because
absolutely.
it sounds like you are a personal fan of this one.
Oh yeah, absolutely. I mean, everybody should be on all those naltrexone. Everybody. Absolutely. Low dose, there's it's the epitome of immune modulation, and there's nothing wrong with being on low dose naltrexone, at low dose, really. Yeah.
All right, you guys, I told you an hour. I wanted to stay true to that. I really am interested in the NBA finals and all of you in
Ha!
Texas there.
Yeah.
I don't know if we got anybody from the East Coast here, but definitely West Coast. So I want to get you these codes. Appreciate Frank, appreciate all of you guys. We do have more resources on Methylene Blue. So I think this was a great, not just an overview. I think this was in depth. We got the biochemistry, we got the pharmacology of it. We got dosing of it. We've got mixes of it. This was amazing and free to you with his time. And yet there are other resources, including where to get it. So I did record the presentation that I put together, which got into some of the treatment plans and packages that included ozone UV, vitamin C, Myers cocktails, procaine, glutathione, and that might have been it, and methylene blue. And then also some of the marketing aspects of Methylene Blue, came up with some fun ideas. So that's all in this little recording here. We're selling it for $100 if you want to scan that code. But we are giving it away with the peptide course tomorrow. So you can get the peptide course for $4.99 and the Methylene Blue presentation comes with it. Everything though that we recorded at the regenerative aesthetics course, being there live was a totally different thing. It was phenomenal. But this is consent forms, this is patient handouts, this is the whole mini vault, we call it, on glutathione, methylene blue, procaine, and also Lexi stuff on injections. So we now have that as a one product thing for $450. So you go from 100 to 450. If you become a member for $485 a month, you get all of this. So think about that too. You got the methylene blue resources, the regenerative aesthetic resources, all the ozone, EBU, etc. If you become a member, and then like I mentioned, this peptide course is tomorrow, Friday and Saturday. If you cannot make it, like Courtney's going camping, if you cannot make it, everything will be recorded. You get all the slides. I just went through and added consent forms and patient handouts for gobs. I keep saying that word. My daughter's making fun of me. Lots of the peptides we're talking about. So again, here at MedMasters, we always want to give you the medical stuff. Yeah, but then the practical implementation side. We've got Jeff Cohen, if you guys have heard of him, an attorney in our space, talking about the legal aspects of providing any service that's not FDA approved or off-label use. Leonard from New Bio Age, marketing. I'm going to give a presentation on email marketing, plus the peptides. We've got John Harmon and Suzanne Fury. I was just with Suzanne and Lexi last week in Atlanta at their practice, at Suzanne's practice. I went through the slides. They're so great. And a lot of these presenters, including Franck, you guys are presenting at the peptide convention congress next week, right?
That's correct.
And I looked at all that. Those are great topics, great stuff too, about the same price. So peptides are here to stay. One of the things again is the even alternatives to peptides. So we've got that class. It comes with the Methylene Blue presentation. So just wanted to give you that offer because it might make a little bit more sense to spend a little bit more money. So here is oh yeah, follow us on social, but here's the links to each of those. So you guys can, if you scan those, it'll take you in. You can learn more about it if you want to. But again, it just might make sense to do one of these other classes. Everything's recorded. Today's recorded. You'll get it in your inbox. Know that we didn't do the slides separately, but they're all part of the recording. Well, if you attend tomorrow, I've got that list of everything from New Bio Age in their network. I can probably attach it in our email reminder or email follow-up to this presentation as well. And then you guys would have that. All right. I think that's it. Thank you so much, Franck. It's been a pleasure having you. Great topic.
Likewise.
Thank you for all your interest. You guys go out and serve more people, do better, make people well, and go Dallas Mavs.
Thanks, Kim. Thanks for having us. Thank
All
you
right,
so
guys,
much.
take care. Enjoy your evening.
Thank you. Bye-bye.